Hi, friends. Frank Turek with you. We are live April 6th, 2020. It's 11:30 a.m. on the East Coast. It's 8:30 a.m. on the left coast, and we're bringing you Hope One. We're trying to bring you hope in a period of crisis. That's what we're doing every day here during this season. And over the past month or so, I've had a medical doctor on our podcast, our I Don't Have Enough Faith to Be an Atheist podcast. His name is Dr. Daniel Eichenberger. He is a friend of mine. He's been a medical doctor for 30 years. He's been CEO of a major hospital in Indiana. Right now, he not only consults with other hospitals, but he also treats coronavirus patients personally and with a team. And in every instance over the past month, I've had him on the podcast 3 times. He's brought a shot of sanity into a sensationalized culture. So I thought we would bring him on today live so he could not only give us an update as to what's going on, he could also answer your questions directly. And if you're tuning in via YouTube or Facebook, you can type your questions in a little bit later about the last 20 or so minutes of this live stream. We'll get to your questions, but I want to bring Dr. Daniel Eichenberger on right now. He's coming to us from Indiana. Dr. Dan, how are you this morning?
I'm good, Frank, and thanks for having me with you this morning.
Oh, thanks for being with us, man. You shoot sanity into every sensationalized program that we try and tamp down the sensationalism here, quite obviously, because if you go online, as you know, you go to Fox News or MSNBC or CNN or even the major networks and many of the major newspapers, you think the sky is falling and it's the apocalypse. And while this is a serious issue, as you have pointed out, there's a lot of reason for hope. So that's what I want to talk about today. In fact, let's just talk about the current situation with you personally, Dan. You're treating coronavirus patients right now, you and your team. How many do you have and how are they doing and what are you using to treat them?
So yeah, I work with the hospitalist team and we have anywhere from 12 to probably 20 or so active patients. And we see a lot of patients who get admitted for what we call a rule out corona. So we have, we can have upwards of 30 of those on different floors until you get the test results back that are negative. You have to treat them if they have it. So it's a burden just because of the amount of effort it takes to, gown up, gear up, and go in and see the patients.
And last week on the podcast, you had mentioned that you had 4 different patients come in one week, all with the same symptoms. How many of them had coronavirus?
Yeah, 1 out of 4 had coronavirus. 1 had RSV, which is respiratory syncytial virus. 1 had the human metapneumovirus, which is another respiratory virus. And 1 had a virus called parainfluenza type 4. So, but they all looked the same. They all came in coughing, wheezing, fever, and short of breath.
And at what point should a patient go to the hospital? Is it the short of breath part that is the determining factor?
Yes. We will see a lot of people with mild symptoms, but in this time, the worst place you want to be is in a hospital. I mean, that's where the sickest
Right.
people are going to be. So you want to avoid the hospital at all costs. But certainly if you're significantly short of breath, you need to be seen by someone. And, the emergency room, the urgent care center, or your private physician's office, if you can call them and touch base with them and give them some information, they usually can help direct you to where you need to be.
Now, we hear a lot of talk about asymptomatic patients out there. There's apparently a lot of people who already have gotten the virus. They don't even know they have it. They haven't experienced symptoms. What is the current situation and how does that affect current numbers with asymptomatic patients, Dr. Dan?
So the asymptomatic patients are now being recognized as a much bigger population than what we originally had thought. So there are a lot of studies out now. The CDC is currently estimating that completely asymptomatic patients are up to 25%, and that's our own CDC. When you look at some of the studies, the Japanese people who came back from Wuhan, China, were tested when they returned, and up to 38% of those patients were also asymptomatic. And then you look at Iceland, who has tested more of their population than any other country. They've tested 5% of their entire population, and they have sometimes up to 50% of patients who are completely asymptomatic.
What does that do for the death rate then?
So as we talked before, the death rate is the number of people who have died divided by the number of people infected. So if you have 25 to 50% more infected people, and that raises that bottom number, that brings the total death rate down significantly. If you look worldwide and you just add 25% to the worldwide number, the death rate goes down by more than a percentage point.
And right now, the current death rate in the United States, given the numbers we have, which are not entirely accurate for the very reasons we've discussed, what is the current death rate right now, would you say?
It's probably still around 2.6, 2.5.
Okay. And it's probably, in fact, from the people I've been listening to, Ben Shapiro has done a good job of having a number of doctors like yourself on his program. And I was listening to him this weekend. He had a Dr. Atlas on. Great name to be a doctor, Dr. Atlas. Anyway, he was saying that given the numbers he knows about, that the death rate is probably lower, significantly lower than 1% in actuality. Would you say that's fair?
I would say when we're all done with this disease and we're able to look back at the numbers, I think it's going to be a very low number, similar. I think it's going to be between 1 and 2.
Here's one thing we need to point out, and this is a reason for hope, ladies and gentlemen. Of course, every death is a tragedy. We're not trying to minimize death. We do, however, want to put things into perspective. For every story you see out there in a newspaper or on a cable news outfit or outlet or something, for every story you see about somebody dying of coronavirus, that means there are at least 99 stories that are never told for people who have recovered. So while it seems that this is a huge deal, and it is to a certain extent, obviously, it's not as bleak as the news media will tell you. And if the death rate is less than 1%, we're going to lose a significant number of people. But the news feed that keeps going into your mind every day is very one-sided. They're not going to report all the people that recovered. You're not going to have 99 stories about recoveries. You're going to have a lot more of one story about people dying. Dr. Dan, why are some people with respiratory symptoms not being tested right now?
Well, that's a good question, and a lot of people are asking that question. So a lot of hospitals and a lot of states have very specific criteria on who they test because the testing goes through the state lab still. So a lot of hospitals don't have set up the ability to test in their own lab. So if they have to send it to the state lab, the state given specific criteria to who to test. And if you don't have a defined exposure and you're just mildly symptomatic, then you're going to be declined on that test. So Indiana is one of those. Some hospitals do have private contracts now with a LabCorp or Quest or some of the other major labs to do that. But some of the smaller hospitals still have to send their specimens to the state. And there is very specific stepwise guidelines that you have to meet, and just being symptomatic without a known exposure, without a high risk issue, you're going to be declined. So a lot of patients are turned down.
You know, there was a story in the Washington Post, which should tell you something. Anyway, it was over the weekend. It was saying that there may be more deaths from coronavirus than we know about because several people who die are tested for coronavirus, and they consider it wasteful to try and use those tests on people that have already passed. So the death toll might actually be higher. But what might be the counterpoint to that? Well,
the counterpoint is that the death rate could actually be lower, because if you look at what Italy has done, and some of the reports coming out of Italy is whoever is collecting all the worldwide information is at the mercy of the people submitting the information. So there's been some reports that Italy has used the last several years of data, the death rates between, say, January and March, and averaged those out. And then they've taken the death rate this year and the variance between the average and the excess this year they've attributed to coronavirus. Now it may be true, but it may not be true. It may be that, the age of the population and their disease processes outside of coronavirus has caused the excess death, not coronavirus. So until we have a uniform definition and how we're reporting, the data is just skewed in some regards, and we really don't know exactly what those numbers are.
How many people do you think might be being reported as coronavirus deaths when they would have died anyway from another disease like a terminal cancer or diabetes or some other condition that they had, pneumonia, and just because they tested positive for coronavirus, they always say, oh, it's got to be a coronavirus death, when in fact the person would have died otherwise?
Well, I'm pretty certain that's going to happen. If on a death certificate coronavirus is listed anywhere as a contributing factor, it's going to be labeled and submitted as partly a corona death. So it's going to be counted in the number.
Now, this is one of the reasons why we get these wild estimates from different models. We get models that are saying 2.2 million could die in America, down to just a few tens of thousands. What are some of the assumptions that go into these models, Dr. Eichenberger? Because why would we get such wild differences? What are the assumptions that people are putting into these models that might not be true?
Well, so now that we've recognized that there are asymptomatic individuals who test positive, some people are going to use the current death rate number, the statistic, and they will use the death rate, the higher death rate, and then attribute that to the increased number of asymptomatic individuals and come up with a higher number for a death rate than what is actually occurring. So again, it's using the numbers to present a narrative that you want to put out in the public.
Hang on a sec, Dr. Dan. This is a live broadcast, so there's some mic noise going on here. I don't know if it's me or if it's you. Is your mic rubbing against something? Or is that someone else on the feed? Jorge, can you check into that?
Yeah, no, it looks like it's a mic rubbing against somebody's clothing. It's not mine. It might
clip
be...
that. It might be you, Dan. I don't know, but we're just trying to eliminate that. Okay, there you go. Maybe that's it. You might have just been flexing below the chest there that was causing that. I don't know what that was, but okay, we got that squared away. Anyway, yeah, there are so many assumptions. And this is why I say that science doesn't say anything scientists do, because when you don't have all the variables, when you don't know what the answers are, you have to make assumptions and plug those numbers into your model. And if the scientists select certain assumptions, those are going to be assumptions that drive the model. So it's not so much science talking, it is partially the scientist who is selecting those assumptions. And as we pointed out on the podcast, I'm just going to list these now. We don't have time to go into all of them. And here's some of the assumptions that are made in each of these. You just mentioned one of them. One is the transmission rate. We don't know what it is. Although you did mention, Dr. Dan, that we know transmission rates for certain diseases like measles. How does that differ from what we think the coronavirus transmission rate is?
Sure. They use a number, they call it an R naught. It's an R with a kind of a zero with a line through it, and they call that an R naught number. They attribute that to viruses and other contagious diseases, and it's basically the average amount of infected people from an individual. So if one person infects two people, the R naught number will be a 2. If it's 1.3 to 1.8 like the normal flu is, that means each individual could infect 1 to 1.3 individuals. But so measles has an R naught value of 18.
Wow.
So every infected measles patient potentially will infect 18 other people. It is a very significant disease and carries a lot of morbidity and mortality, which, most of the younger generation has never seen measles because we've virtually eliminated it in the United States. We still see pockets because people are foregoing their immunizations, but the R naught level for coronavirus right now is somewhere they think between 2 and 3. But now with the increased number of asymptomatic patients, we're not sure where that number is going to land at this point. Certainly with other diseases, it can be anywhere from 4 up to the 18. Measles is probably one of the most contagious diseases we know.
And this one we think is, instead of 18, it's 2 or 3. And that's an assumption that we haven't been able to verify yet. There's so much data that we don't quite have yet. But it is fairly contagious, as you've pointed out before. But that's an assumption that's put into these models. The number asymptomatic, we already talked about. How about the number already immune? There's something out there known as herd immunity. Can you explain what that is, Dr. Dan?
Sure. Herd immunity is the fact that when you get enough people who are immune to a disease, basically, if someone comes in with the disease, they don't have a vector to transmit it. If you got enough people who are already immune to it, they can be in contact with them, but they're not going to become infected. So the herd immunity prevents the spread of a disease because most people are immune to it. So that's what's happened with measles over the years. It's not that we have 100% immunity to measles, but there's so few people left who aren't immune that it's difficult to get a pandemic or an epidemic related to that disease. But as we see, the millennials and the Gen Xers who don't like immunizations, who aren't immunizing their kids, we are starting to see pockets of measles again because of that reason. So it is important to develop herd immunity. Now, you can do that naturally by getting the disease itself, or you can do that artificially by, vaccines. And so with coronavirus, we're going to see a combination of the two. As soon as we get a vaccine, it's going to help with the herd immunity. And therefore, when this comes back next year or the year after, we're going to see less and less problem arising from it.
Some are saying that the situation in California, which is far better than New York, quite obviously, could be because of that, because California is not experiencing the kind of havoc that New York is right now. Is herd immunity a possibility there, Dr. Dan? And why would they be immune in California and not New York?
Certainly herd immunity could be part of the explanation for why.
Okay,
well,
Dr.
we just lost Dr. Dan.
Dropped again.
He just popped out.
Yeah,
all right,
so
well, he's gonna try and rejoin us. Why don't we do this as he's trying to pop back in? This is a live broadcast, ladies and gentlemen, so sometimes these things happen. Let me say a couple of quick things, and then we're going to go back to Dr. Dan. Right now, it's April 6th. This week, we're starting 2 brand new online courses that you can be part of. If you're home, you might as well be home with us. And one is called Why I Still Don't Have Enough Faith to Be an Atheist. I'll be your instructor for that. And the second is called Fearless Faith. I will be joined by Detective J. Warner Wallace and Dr. Mike Adams for those 2 classes. And here Jorge has it up, Operation Inoculation right there, as you can see. And they Zoom sessions, if you take the premium version of the class, begin tomorrow. You still have time to join. If you watch this after April 7th, you can still join this week anytime. And you'll be live on Zoom with me for I Don't Have Enough Faith to Be an Atheist, and with me, Jim, and Mike for Fearless Faith on 8 different occasions, twice a week over the next 4 weeks. We're sequestered. We're quarantined anyway. You might as well be with us. And Online Christian Courses has cut all the prices in half so you can be a part of it. So if you want to be a part of that and take those 2 courses or either of those courses, you can do so. Just go to crossexamine.org, click on Online Courses. You'll see them there. And in fact, our first Zoom session for both those classes is tomorrow. And those Zoom sessions are for Q&A, except when we're on Zoom, everyone can see everyone and we can talk to one another directly. We're about to take your questions here in about 20 minutes of Dr. Dan. What you need to do is go to YouTube or go to Facebook and type in your question in capital letters so we can see them, see the questions there, and write in complete sentences. It's got to be a succinct question, a question that's easy to understand, because we're going to have to filter through a lot of them. Just type it in all caps so we can see it. All right, Dr. Dan, you're back. You got rid of that virus on your computer, and now we're trying to get rid of the virus called coronavirus out there. Let me ask you a question. We talked a little bit about herd immunity, and I think you were trying to complete your thought on that. At California, at least partially, the result could be herd immunity. There's been a lot of Chinese that have come to the West Coast in the past few months that may have given herd immunity to the California population. And you were about to say something else. Why don't you pick it up right there?
Sure. So the travelers from China, Japan, and other places certainly could have brought in the herd immunity. The other issue is that California's weather is significantly different than New York's weather this time of year. And the transportation modalities in California are different than they are in New York. So California did not have the New Year's Eve party celebration like New York City did, and some other mass gatherings that may have contributed to the outbreak in New York City. So in California, people get out in the sun a lot more, and they're not, the population density isn't like it is in New York City. So I think there's a number of factors.
And the subway too, you've mentioned that before. I mean, there's a mass gathering every day underneath New York City in the subway. Yes. I don't think they've shut those down. So there's a question too about how realistic is it, Dr. Dan, that we could actually eliminate this virus? And when would we be able to eliminate it?
Well, it's not realistic at all to think we can eliminate the virus. And it's really unrealistic to think that China, even now, I'm not taking up for China in any means, but just because they delayed telling us, when you look at the rate of asymptomatic people, those asymptomatic people would have been traveling. They would have spread this virus at some point. So there's no way you could have contained this virus in China, no matter what we did. I mean, that's just the nature of viruses. We have to accept the consequence and the reality that these viruses are going to be around, and it's our response to them is what's most important.
Now, what we've been doing lately, as you know, everyone knows we're quarantined, we're distancing, we shut down much of the economy in order to flatten the curve. Explain what flattening the curve means, and is it working?
Flattening the curve is, instead of having a mass amount of positive cases all at once, we are bringing that peak down and spreading it out over a longer period of time. What that does for the healthcare system is allows them to see fewer patients over a longer period of time and not overwhelm the system. Now, certainly in New York City, it wouldn't have mattered. I mean, flattening the curve is helpful, but they are still overwhelmed. And this is more of a logistics issue than it is a real medical crisis. I mean, the patients aren't that difficult to take care of as far as their disease process. The difficulty is the amount of equipment it takes to take care of the patients and the amount of personal protection equipment, the PPEs we've talked about. Getting all that equipment to the right people at the right time in the right place is what's important. And that's what we've not been very good at logistically. So to think that the media talks about, a shortage of ventilators in the United States, well, that's only if you have every corona patient, crisis occurring at the exact same time, and you overwhelm all 50 states' ventilators at the same time. The realistic aspect of that happening is zero. That's not going to happen. We're going to see waves in different areas. We're going to see waves in different communities. Certainly cities with the biggest populations and the most density is going to have the biggest problem. So we need to figure out a way to get mobile hospitals, mobile units, extra personnel, and the equipment they need in the right place at the right time.
I've noticed that the U.S. Navy Mercy ship that went to New York, at least as of a couple of days ago, despite the fact of having over 1,000 beds, they only had about 20 people on that ship. So is New York in as dire shape as some in the media would suggest it is?
No, and the reason for that is just like the rest of the United States, hospitals and communities that don't have a huge outbreak of coronavirus, with the lockdown, our hospitals are at 50% capacity, basically. I mean, we have a lot of empty beds because nothing elective is being done. So the Mercy ship is also, if you're only looking at doing the elective cases or the emergent cases, you're going to see a whole lot fewer of those. So the Mercy ship is going to be underutilized if you're only using it for that purpose. Again, New York needs to, they need mobile hospitals that can take care of the volume of wheezers and fever patients that are presumed to be corona positive. That's what they need. So the Central Park hospitals that they've got set up, those are really important to help offload the patients from the ICUs in the real hospitals.
Yeah, the Central Park Hospital was put together by Samaritan's Purse, a great organization led by Franklin Graham. And I'm just going to say this on this on this live stream right now because I have to get this off my chest. But Bill de Blasio, the mayor of New York, was upset basically about Samaritan's Purse because they take a biblical view of human sexuality. And he was concerned that there would be discrimination against people of the LGBTQ community. What he doesn't understand, he doesn't understand a lot. Number one is that Samaritan's Purse treats everybody regardless of how they self-identify. They're there to help people. Secondly, if he's gonna come out against Samaritan's Purse because they don't agree with him, which up until about 10 minutes ago, even the Democratic Party agreed with Samaritan's Purse in the sense that they didn't believe in same-sex marriage. It wasn't just until 10 minutes ago in the entire scope of human history did people suddenly start accepting homosexual behavior as being the same kind of behavior as heterosexual behavior. And Barack Obama, his hero as the president, came into the presidency being against same-sex marriage. He changed his mind midstream. And yet you have a man who apparently has no transcendent standard by which to judge anything Samaritan's Purse is doing, judging Samaritan's Purse for actually trying to bring good to the people of New York City, regardless of how they identify sexually. So I just had to get that off my chest. Sorry, ladies and gentlemen. Dr. Dan isn't here to hear me rant, neither are you, but I had to say something about that because that is completely ridiculous. You have no standard by which to judge anything right or wrong if there's no God. So get off your high horse. Without God, nothing's ultimately right or wrong. Nothing Samaritan's Purse does or anything else is doing is right or wrong. You got to get back to God to figure out right or wrong at all. All right, Dr. Dan, sorry about that. By the way,
Sure.
Dr. Dan has also been to our Cross-Examine Instructor Academy, CIA. For those of you that want to know how to present apologetics, present the evidence for Christianity, go to our website, crossexamine.org, and click on events. You'll see CIA there. How about masks, Dr. Eichenberger? What about masks? We're hearing conflicting stories about masks. Should we be wearing masks everywhere?
Well, it's an interesting, we are probably way behind the 8 ball now that we see that there are lots and lots of asymptomatic people. Are masks going to help? Masks are really the most beneficial when you put it on an infected patient because we know most of the transmission is due to the respiratory droplets that are spewed out by coughing and sneezing and even normal talking to some degree can put the viral particles out there in that 6-foot range basically. So when you have an infected patient, if you can put a mask on an infected patient and all that stays basically within the mask, it decreases the distance that those viral particles can travel. So yes, I mean wearing masks for everybody, sure, it's gonna help some, but we're probably well behind the 8 ball of actually that being the biggest impact at this point. If you're gonna be in a huge crowd of people, sure, it's probably worth wearing a mask. If you're gonna just go out, to a regular store and there's not huge crowds, I'm not sure the benefit. And it's still right now. The president said yesterday it's a voluntary suggestion at this point.
But if you're asymptomatic, you don't know you have it. You could be transmitting it to other people if you don't have a mask. If you're in close contact, correct?
That's correct.
Okay, so it's not going to hurt wearing a mask. But on the other hand, I'm hearing conflicting stories about whether or not masks are really effective. Wearing them, whether you have it or not. So, and as you know, you've heard these stories on this is part of the problem. There's so much sensationalism out there. Somebody the other day had a story about it's 27 feet and others are saying, no, it's 6 feet. What's the truth? Do we even know?
Well, if you talk about a normal routine sneeze, it's about 6 feet.
Okay.
Again, if you're talking about someone who really wants to spread the virus and they really want to do an aggressive sneeze and spew it out as far as they can, sure, it's possible you could probably get 27 feet, but that's not the norm.
Okay. Well, you haven't seen my wife sneeze. She can really, she lets it rip, I'll tell you. All right. How about, why are there people and media sites claiming that we're in the war? we're the worst in the world. The United States is worst in the world in combating this pandemic. Why are they saying that? And is it true?
Well, it's not true. And it's disappointing when you see it on Facebook and Twitter and some of the other social media sites that are putting the United States down. If it wasn't for capitalism in the United States, we wouldn't be where we are now with coronavirus research, development, trials. I mean, a few other countries are doing things, but we have certainly brought up the standard for the research and development piece of this and developing testing far greater than any other country. And, you know, what's disappointing is typically when the United States is prosperous, every other country is prosperous more than they would be without us. And if we decline economically, then these third world countries that we are routinely helping are also going to feel the impact of this virus a whole lot more than what they would if we were continuing to be prosperous and generous and reaching out to them. So the decline of the United States economy is not going to only be felt in the United States. It's going to be felt worldwide with these other countries that we routinely help with medical care and other services. And
our innovation, without, you mentioned, without the golden goose of capitalism, you would not have the medical advances that we can give to the world. I have people emailing me, well, look at everybody has healthcare in London or in UK. Everyone has healthcare in Canada. What people always forget, first of all, everyone has healthcare too here in the United States. They might not have health insurance, but when people always forget is the advances that are made in our system benefit the whole world. If we did not have the advances because of the profit motive in the United States, because of capitalism, nobody would benefit. We're the golden goose that feeds the entire world. And if we kill that golden goose, everybody's going to suffer. So that's an amazing insight, Dan, for bringing that up, because people don't realize how important our system is to the entire world. And how about this question about where we stand right now? I know Governor Cuomo up there in New York a day or two ago saw a decrease in deaths. He may be saying, well, we may have hit a peak. Maybe we're coming down the backside of this. Do you think things are improving right now? Absolutely. I've tracked the numbers and the data every day since the beginning of March. And when you look at the trend, it looks like we have peaked and we're on the decline, both in New York City as well as the United States as a whole. So we do have some positive numbers to show. And like I say, if you put that on a graph, you would see the graph starting to decline, both the death rate and the infectivity rate. So I do think there's a lot of hope out there that we have turned the corner at this point. You're probably not going to hear that from the media at this point yet, but I do think we've seen that. Now, a few weeks ago, I asked you the question about shutting down the entire U.S. economy, and you said that was too drastic. We should still practice social distancing and washing our hands and all that, but to shut down the entire economy would have too many negative effects, even on people's health. In fact, let me bring our audience up to date. You had a patient that normally would have had a surgery, a bypass surgery, and couldn't have it because of this coronavirus. What happened to this individual? Yeah, that particular individual died of a heart attack that may or may not have occurred if they had the bypass. And then we've had other elective procedures that have been delayed, and patients have had to alter the form of treatment we normally would have done because hospitals aren't allowing elective surgeries to go on. Now, you could typically fight and say, well, this isn't elective, this needs to be done. But, you know, a lot of physicians won't do that, trying to comply with the recommendations. And but again, that's why our hospitals are sitting in our communities. I've talked to 6 different hospitals in our community. We're sending people home, sending staff home and closing units down because we don't have patients to put in them. We have the rule out corona patients that are on the floors, but the routine stuff we normally see are not there. So a lot of hospitals have a huge financial impact to their bottom line because the routine elective profitable cases are not being done at this point. So there's going to be a lot of economic turmoil for hospitals. Certainly back in 2008, after that recession
recession. We saw the homelessness rate go up about 13% across the nation for those people who reported. We saw increased alcohol abuse, increased domestic violence problems. We'll see ongoing delays in patients getting medicines and doing doctor visits and other types of medical care just because of the economic downturn. So again, we don't want the disease to be less than what the cure is. I mean, if we're putting all these things in place, the long-term consequences, and again, even worldwide, if the United States takes a huge hit, other countries are going to take a hit because of our financial downturn as well.
But what would you do now, Dr. Dan? I mean, I say this every time I talk about this issue because people get all annoyed when you suggest you're not taking it seriously. We're all taking it seriously. But that doesn't mean that every way to take it seriously is equally valid. We say on this program, we're all Christians, so whatever the governor tells us to do, the president tells us to do, unless he tells us to sin or he prevents us from doing something that the Lord tells us to do, we're going to obey. But if you were the president right now, or you were the governor right now, what would you do? And I suppose it's going to be different in different areas of the country, right? Like Wyoming doesn't have any deaths. There's no reason to shut down Wyoming, like you might say shut down parts of New York City. What would you do right now?
Sure. So I would identify which areas are hardest hit, and I would try to get the logistics fixed for those areas. In other words, make sure they have what they need and when they need it. But I would start allowing and opening up, the businesses in the areas that aren't hard hit. And then every community should have a plan in place that if the numbers start to increase, they have alternate hospital sites. When I say alternate hospital sites, that could be, the Central Parks of New York or the convention center they're doing here in Louisville, or, identify your local surgery centers that are owned privately. You could, basically rent from the owners and use those as hospitals. Look at other big areas that you could set up temporary mobile units in. Every community should have a plan in place to deal with an increase in numbers if that were to occur. But to shut everything down when we're not seeing the impact is really not beneficial to the individuals or the communities themselves.
Well, some people will say we're not seeing the impact because we have been doing all these draconian measures right now. I guess it's counterfactual. It's really hard to figure out what would have happened. But you were an advocate of social distancing, and you were an advocate of washing your hands, obviously, and all these things. So it's really hard, I guess, to come up with an accurate answer, just like it's hard to come up with an accurate prediction given the fact there are so many different factors that go in that are just unknown, so many different assumptions for every model. Well,
let me interject there. So when this first started, if you look back at the predictions people were making, they were making, millions of people dying from this. And now, they brought it down to 100 to 250,000. Now, the media always uses the high number here in the United States. But when we originally talked about this and the media was really hyped up about it, it was in the millions. And now, that number has come down significantly. And I still am not sure we're going to hit that number they're claiming at this point. So it's amazing when you look back at what the predictions have been and where the reality is falling out. So I do think it's important to keep in mind what the media tells you has a bias and has a narrative they want to present that may not be accurate.
In fact, I had Dr. Doug Axe on the program last Thursday, and he was saying it's not just on medicine issues, but it almost seems like on many issues in our culture, if you take a contrarian view, you're basically ostracized for taking a contrarian view, despite any facts you might have. There's almost like a groupthink that goes on in our society now, that there's a right way of thinking about every issue, even though there's so many variables that go into trying discovering what the real outcome will be. There's a right way of thinking about it. And if you don't take that right way, you shouldn't even be able to talk about it publicly, which is really a very sad situation in a country that's supposed to be the land of the free, the home of the brave, the people that have in their constitution, freedom of speech, freedom of association, talking about all these things, and yet people get upset when you say, I'm not so sure that's the right prediction here, and here's why. So
the social shaming has been a huge part of this, from the mainstream media, let alone.
Oh, there goes Dr. Dan again. See, as soon as he starts talking about the government, they shut him down.
So let's do this again.
That's not what's going on, ladies and gentlemen.
It won't take for a minute, but this is look, Frank, I'm watching a lot of the audience thanking you for bringing this discussion front and center on our channels. Dr. Dan, he's back in.
He's back, Dr. Dan. So Big Brother was looking at you, bro, and he said you were just about to go too far.
Right. For us Christians, this is what we call spiritual warfare.
Right. I was actually telling Frank how people are reacting on our channels, Facebook and YouTube, how thankful, how grateful they are that you two are talking and really bringing into some real facts, some real data into the discussion. So I'm just going to let you guys continue, and we'll be back for the questions in a few.
Actually, let's go to questions right now.
Okay.
I got 20 minutes or so to go, and then we'll have a few minutes at the end for Dr. Dan to wrap it up for us. But see if you can find some questions.
So I got this one is good one. Is a good one from Frank. It says, can we fortify our immune system now to reduce the severity of the virus if we get infected next week? What can we do to prepare if there's a way?
So there have been studies and some clinical evidence that does support the evidence of zinc supplementation, vitamin D supplementation, and vitamin C supplementation that may help either minimize your chance of getting it or decreasing the severity of the disease. So now, again, we won't know until all this is over and we're able to do some clinical trials specifically, but certainly those medicines and supplements in routine doses. So vitamin C, they're recommending anywhere from 4,000 to 6,000 milligrams a day in divided doses. Zinc, 50 to 100 milligrams, and vitamin D, depending on which, 5 to 10,000 units a day can be used to help fortify.
Good deal.
Excellent.
Sam asks, where do we draw the line between not living in fear during this time and being smart about not spreading or contracting the virus?
So everything we do in life is a risk. Getting out of bed in the morning is a risk. So you have to decide what your risk tolerance is when you want to do something. I think complete isolation is a risk in itself for a number of reasons. So I don't think complete isolation is the answer. I think if you need to get out and do things, you do it in a reasonable fashion. You would want, especially in a community, if your community has been hit hard, like New York City, you want to take extra precautions when you go out. And so if I was a New York City resident, I would wear a mask if I went out. If I lived in Wisconsin and going to the grocery store, I would not wear a mask to go to the grocery store. So I think you have to figure out what your risk tolerance is and understand that once you go out and you meet up with someone else, they've also taken a risk. So they've accepted the risk of being out in public. So I think you have to be cognizant of the fact that if you restrict liberties too much, that's a problem in itself, especially here in the United States.
Dr. Dan, too, we see these comparisons in the media. We could pass the number of men who died in Vietnam, 58,000 with this thing, as if that's relevant. I mean, we pass that almost every year, or we get close to every year with regard to the flu, and you never hear a word about it in the media. Why is that? Why? I mean, right now we're about 10,000 deaths in the United States attributed to coronavirus. We may or may not get to 60,000, which is what the current estimate is for deaths of the flu, the standard flu this year. Why are they making these comparisons? And why is it relevant, or is it relevant?
Well, it's probably not relevant, but it's sensationalizing the disease. And that's what sells TV programs and radio stations and other things. But when you look at the CDC's website, I mean, they have an upward estimate right now of 62,000 influenza deaths in the United States alone, with 55 million infected. So that's the higher side, the CDC. They have a lower side of around 38 million infected and 38,000 who have died. So somewhere in between there, we've already seen that. You know, you look at that compared to the coronavirus deaths so far. I mean, we're anywhere from 5 to 10% higher in flu deaths than we are corona deaths as of right now. And we know the season is almost over. So the odds of having a significant amount of corona deaths related to this particular season is probably not likely.
So 5 or 10%, if the current death rate or death toll is 10,000 approximately as of Monday, April 6th, and we've already lost anywhere between 38,000 and 60,000 for the flu, it seems like it's much more than 10% difference, isn't it? It's an orders of magnitude difference for the flu.
Yeah, 5 to 10 times is what I meant.
Times. Oh, okay. I thought you said okay. Again, is that a valid comparison? Does it make any sense to compare it to the flu, or what are the differences between this and the flu?
So the difference is the current flu that's going around is known to us and known to our immune systems. So even though we will have a lot of infections, they'll typically be a little milder overall. This coronavirus is a novel virus, so we have not seen it with our immune system. So we would anticipate more people being infected with coronavirus than we would influenza. Although since it started later in the year, basically flu starts October 1. The flu season runs from October 1 through about the end of April. So if coronavirus would have started on October 1, the death rate would be a lot higher. But since it started, basically into February, and we've only got a couple of months worth of the season left, we're probably not going to see the same types of numbers.
Hey.
Go ahead, Jorge. What else we got, man?
Good. I got this one from Braxton. He says, what metrics will be used to determine when we can return back to normal as far as going out, shopping, going to church, etc.?
If you listen to the president and his team and the physician lead on this, he made a statement that, when you see 0 cases and 0 deaths, well, that may not be for 2 years. So, I mean, we may see new cases and new deaths through the end of the year for sure, without a doubt. So you can't use that as a metric. So you have to come up with something that's reasonable. And right now, what we're doing, in my opinion, is not reasonable. It is reasonable in New York City. It's not reasonable in Montana and Wisconsin and, areas that aren't hard hit. So I think each governor and and the president are going to probably give us some guidance over the next week about when we can start reopening things. But it can't be 0 cases and 0 deaths. That's unreasonable.
Right. That's one of the problems when you have somebody who just has a medical background and is just giving the medical opinion and isn't seeing the entire picture. Because as you've talked about from the very first show we had, Dr. Dan, that if this is done wrong, more people will die from the economic impact than the medical impact. And if we keep everything shut down through the summer, it's going to be a Great Depression. More people are going to die from surgeries that are put off, doctor's visits that are put off, medicines not taken, unemployment, domestic abuse, alcohol abuse, drug abuse, suicides. It's going to be much greater cost than the coronavirus. Disagree with that, or you still agree with that?
Totally agree. I have a colleague who's an addiction specialist who we've already seen a rash of relapses in both alcohol and narcotic abuse. So AA meetings are being canceled. Narcotics Anonymous meetings are being canceled. The British Journal of Psychiatry, back after the 2008 recession, did a study and documented 10,000 additional suicide deaths related to the recession and the economic downturn. We've talked about the homeless population. Homeless population went up 13% after the 2008 recession. You think of what that impedes on the community and in the individual lives. The kids who are homeless, lack of food, lack of access to medical care. All of those things are going to increase the longer this economic recession goes on.
Mm-hmm. Mm.
The problem is we don't have a good way of measuring that and reporting that to a central agency. So even like the homelessness, there's only about 14 states who reported after the 2008 recession. So it could be a lot higher than what we actually know about because of the reporting issues.
And this is why it's a politically difficult, because you can allegedly count coronavirus deaths. It's hard to count deaths that are indirect deaths from coronavirus. As we mentioned, suicide, drug abuse, alcohol abuse, unemployment, all of those issues, surgeries that are not, you even had a patient this week that died from a surgery that wasn't done because you guys had to lock everything down. So it's hard to make the case, but I want to point out directly to people who criticize us for talking like this. We are not comparing lives to money. We're comparing lives to lives. What's the best way to minimize death, not just directly from the coronavirus, but also indirect deaths from the coronavirus, from shutting everything down and causing these dominoes to fall, this ripple effect to occur. It's really hard to measure. It's admittedly hard to measure, just like it's hard to measure the predicted deaths from the coronavirus, because there's so many assumptions that go into it that we don't have good data for. I know. Sorry, Jorge, go ahead.
So good. Mark asks, how far or near are we from reaching the peak and seeing a decline in the infected versus the ones that are dying?
So based on the data we're seeing out of New York and some of the other cities that are hard hit, it really looks like we may have peaked and started on the decline. If we haven't peaked, it's going to be within days, though.
Okay, good. And the warmer weather will help that theoretically. Every other coronavirus has decreased during warmer weather, correct?
That's correct.
That's good. Okay, he says, Carter, isn't the coronavirus test being used not as specific to this current version of strain, but simply test for all coronaviruses?
So that's a good question, and I don't have the exact information from different labs using different tests. Like Abbott just came out with this point-of-care test that could be done in a doctor's office. I'm not exactly sure what protein compounds on the viral envelope it's testing for. But what we call PCR testing, the polymerase chain reaction, you can change those tests fairly quickly and test for the new strains as they come out. So it probably doesn't test for all strains, and as they do the research, they are seeing that we're seeing some genetic shifting and drifting of this virus already. So there are now more than one strain that has occurred in the United States.
Oh, wow. Got this one. Says, Sam, what are the most reliable sources of information to read from to have a rational understanding of the death rate and other impacts of the virus?
Great question, Dan. What do you say?
Well, again, the two leading ones would be the CDC.
And there he goes.
The CDC will try and get Dr. Dan back
you see,
on
every
again.
time he said something like that, he goes out, man. This whole
He's gonna
Jay
pop
Warner
right
Wallace
back
will
up
be
and-
mad at us for being conspiracy theorists.
That's right. Hey, before we go back to Dr. Dan, I want to point out that tomorrow's show, we're going to have Dr. John Lennox on. You know, the great John Lennox, all the way from Oxford University. He's written a brand new book. Here it is. Where is God in a Coronavirus World? Mm-hmm. Where is God in a coronavirus world? We're going to have him on for the first half of the program. I can only do half hour tomorrow, but we'll talk to him about it. We want you to join us. Where is God in a coronavirus world? And also don't forget about the online courses that begin today, actually tomorrow, at online Christian courses. Just go to crossexamine.org, click on online courses. You'll see why I still don't have faith to be an atheist, and also fearless faith. Dr. Dan is back. You were saying something about the CDC. You were actually going to praise the CDC, and they shut you down anyway. Go ahead. What?
So the CDC is the site here in the United States that probably has the most accurate information on a regular basis. And there's a European site that is essentially the same as what our CDC is, that gives the same information. So those two sites can give you both the nations here and then the worldwide data. That's pretty accurate. What's coming out of China still is inaccurate.
You know, there's a website which is an amazing website. I don't know how accurate the data is, but it's called Worldometer. Have you seen that, Dr. Dan?
Yes. And again, it's fairly updated. They keep it pretty up to date for the most part. So that's another good site.
Worldomedia.com. Check it out, friends. Maybe we'll put a link up there. In fact,
there's another one called Fast Stats that also has some decent information.
We'll try to get that on the comments
right.
and pin them there on the comments so people can access them. This one by Cody, I think this is a deep question. It says, my wife is pregnant with our first child. She's at 2 months and we are unsure of how the virus affects the baby in the womb. So will the baby be okay if my wife is exposed? Can it affect the baby in the womb? We are trying our best to social distance and stay safe.
That's an excellent question, and we still do not know what this virus does to pregnancies because we haven't had enough experience. As of right now, it does not appear to be causing any significant problem. But with viruses in utero, some viruses do cross the placental barrier and can infect the fetus. Other viruses don't. We don't know the answer to that question yet. So if a mother would become infected, it depends on what trimester she's in as well, whether or not that would have an impact. We know that certain viruses, like the herpes virus, if you contract that in your third trimester and deliver with an active case of herpes, you can cause significant morbidity and mortality in the infant. Whereas if you contract the herpes virus in the first or second trimester, you may not have any issues. So we don't know the answer to what this virus will do to a fetus.
Hey, Jorge, I want to give Dr. Dan a couple minutes because we're about out of time here. I want to give him a couple minutes to kind of give us a word of hope as we close out here. This show is called Hope One. We like to give people hope. I think you've already done that, Dr. Dan, because you're giving a shot of sanity here in a sensationalized world with these statistics. And as I say again, we're Christians, we do what the government tells us to do, but that doesn't mean we can't talk about and influence our government to change the policy as we move forward. But give our listeners some hope here, not only from the medical side, but from the spiritual side as well.
Sure. So our hope ultimately is in our Savior, Jesus Christ, and God. God is in control of this situation. We need to have, God gives us a free thinking ability and to use our rational judgment based on what is realistic, not theoretical, but what is realistic is important. And keeping a rational preoccupation of our fear and not having that overcome our daily lives is important. So the data looks like we have turned the corner, and everything that's coming out of New York and some of the other hard-hit cities here in the United States does appear promising and look like we are better. So with the warmer weather coming, we know that these viruses typically subside significantly. So everything in the next week or so looks very promising. So use some rational thinking. Stay away from the mainstream media because you're not going to get a fair narrative of what's really going on. And again, pray and keep your trust where it needs to be, and that's our Lord Jesus Christ.
And tell other people about Jesus right now. Their hearts might be open to it because they're considering their mortality.
Correct.
Hey, you know, it's interesting that you say that, Frank, because I received a call yesterday morning that I would have never thought I was going to get. And it was a first window that I had to share the gospel with someone in a meaningful way. You know, it's usually close. It's usually the people closer to you that are the hardest to reach.
That's right.
You know, because they know you, they know your past, they know all the stupid stuff that you've done, and they don't take you seriously. But I had a phone call yesterday that really was short, but it was definitely a foot in the door. So yes, let's do that.
I guess that's one upside of sensationalism. People go, wow, maybe the world is ending. I better get my affairs in order.
Yeah, I got to get my ducks in the row.
That's right. Hey, Dan, can you tell people if they want to get a hold of you, how they can do it?
Sure. I have a LinkedIn account that Jorge will put up on, I think, on the website that you can email me through or message me through. I do have a Facebook account. I don't use it much. I try to stay away from that as much as possible. I use it for grandkids, but that's about it. Right. But I think re-emphasizing what Frank said earlier, that for every one major disaster case you're going to see on mainstream media, you have to remember that statistically there's 98 to 99 other recoveries, and you're only going to see what the media wants you to see from those types of sensationalized issues.
Mm-hmm. Dan, you've been a blessing to us. Thank you so much. And as we move forward through this crisis, we'll hope to have you on again so you can give us updates. Is that all right?
Great. Sounds good.
All right, brother. Thanks so much. Thank you, Jorge.
Thank you, guys.
God bless you guys. See you.